Hi, welcome, and thank you for joining me for this video on releasing the shoulders and the hips. If you found this video, you either have shoulder and hip pain and the miraculous algorithm found you because you've been Googling the heck out of shoulder and hip pain, or you've attended one of my classes and this is your homework video. So welcome. If you guys don't know who I am, my name is Jennifer Durantic. I'm the owner of Fusion Whole Body Recovery in Colleyville, Texas. I've been a medical and orthopedic massage therapist for almost 17 years and a somatic educator for 3 years. So what we'll be doing is actually something called somatics, but it is a retraining of the brain to let go of habitual tension in the body. 80% of us who deal with chronic pain are dealing with functional disorder or functional dysfunction, which means that over time and habitual use patterns, we've developed tension in our body that is now creating bigger issues. Or we've had traumas happen, whether it's been a car accident, a fall, that has immediately caused our body to hold patterns of tension, and then that has over time created a bigger issue. A lot of the issues that are caused by functional dysfunction are things like sciatica, frozen shoulder, rotator cuff issues, plantar fasciitis, knee problems. So these classes are designed to help you fix the problem and not the symptoms, which the symptoms are the sciatica, the knee replacement surgeries, the bone spurs in the feet, those things. So today we're going to be going over how to release the shoulders and hips. So if you're not familiar with somatics and this is the first time you've come to one of my videos, I would highly recommend doing the arch and flatten video because I'm going to be kind of running through a lot of these movements. So the arch and flatten video and the side curl video, because those go into more depth with the first two movements of this series. So what you want to do first is, just like with any somatic practice or any really mind-body practice, is we want to kind of figure out where our bodies are in that moment. So our bodies change from day to day depending on what kind of things that we did the day before that might be causing tension, or things like, you could have been sleeping on one side and you could have had a fall the day before. So every day we need to take a step back and kind of see the way that our body is and what we need to focus on that session. So you're going to lay on your back with your arms to your side with your legs laid out. This is called dead body pose in yoga, or Savasana. So do these movements in a nice quiet room so you can really focus on what you're feeling. And we're just going to start with the feet today. You can switch it up. Sometimes start with the feet, sometimes start with the head. But it's good to train our brain to switch it up. So you just start down in the feet, maybe wiggle the toes a little bit, kind of feel how the toes feel. Move the feet around in circles and move those ankles. Notice if you feel any popping or tension. For me, I feel a little bit more tension on my left ankle, so I'm going to bring my mind's awareness to that during the practice I'll focus on that a little bit more. Then move up to the knees and kind of notice if your knees want to go in or out. If you notice your knees and your feet kind of fall outward, that's a sign of tension on the outside of the hips, because when the hips get tight, they're going to pull you out. Just like if you had adductor or inner thigh tension or groin tension, you're going to get pigeon-toed. So just to let you know, that's kind of how that happens. Then go up to the hips. Kind of feel with your hands the hip bones. Notice if one hip's rotated up or pressing up towards the sky more than the other. That's an indication of rotation. And if you don't feel any of these things, it's fine. The more you do this practice, the more you're going to notice subtle differences in your body. Okay, and then you can go up to your stomach and your chest, solar plexus area here. Take a couple deep breaths. Notice if the breaths are strained or tight, or if they feel nice and full and smooth. And go up to the shoulders, same as the hips. You can put your hands on there. Notice if one side just feels like it's rolling forward more than the other. Most likely you may notice either if you are more dominant with one side or you sleep on one side, that shoulder is going to want to rotate more because it is used more frequently, or with sleeping, you're putting pressure that's causing it to run forward. Notice that. Notice the hands too, kind of with the feet. Open and close the hands and the fingers. Do some wrist circles. See how they feel today. Always scanning the body and taking note of discomfort that you're feeling, because that is the information that you're going to use in the practice and what your mission is going to be. And then go up to the head and notice if your chin is going straight towards the ceiling or if it's going back. That's an indication of tension in the back of the neck. Or if it's going forward, it's an indication of tension in the front. If you feel like your head is kind of tilting naturally to the right or left, that's a sign of tension correlated to that side. So if I notice my chin slightly tilting towards the right, I'm going to know that my right side of my neck is just a bit tighter. So again, take that information and bring it into the practice. So you're going to do a little mental note, go through your body, tick off with a check, or an X, what areas you feel like you need to focus on for the class. And then we're going to go ahead and start with the arch and flatten. So the hips and the shoulders follow what the midline does. So if your midline is overly contracted forward or back, so overly arched or tucked, then your shoulders obviously are going to follow that. So they're going to get rounded if you're over tucked, or they're going to get pulled back if you're overextended. Now, human beings, we tend to have a combination, especially since in our culture we tend to work so much in front of us. So what we end up doing is we sit at computers, and then we're rounding forward through the day, and then we stand up and we're rounded forward, and then what do? We go, oh man, our posture is bad. So we do this. Instead of fixing the problem in the front of the chest, we overarch, so we cause strain in the back and the shoulders. So this arch and flat is going to help open up the midline here and going to cause you to let go of a lot of that discomfort. So it's just a deep inhale in, and I want you to pretend like you're holding a rolling pin on each side of your hips. And it's a deep inhale in, and as you inhale, you're going to roll that rolling pin down, arch your back, press your sacrum down into the ground, and then slowly ease off. Let that arch. You're going to exhale, let the arch lower back down. Let it melt into the table like butter, or into the floor. And when you're completely neutral, inhale in and exhale, and now we're going to tuck. So we're going to roll that rolling pin back, and then inhale in and slowly release it. So this move seems very simple, but what we're doing is we are engaging everything in our back, because when you have an overly tight area, your brain has forgotten how to let go of it. So you can't force it to stretch. What you actually have to do is you go, fine, if you want to contract, I'm going to contract you more, and then I'm going to slowly and consciously release that contraction. And by doing that 5 to 10 times, you're reteaching it its full potential. So as I arch my back, I'm engaging that overly tight back, and I'm opening up my front. So I'm simultaneously teaching my back how to contract and my front to open up, and then I'll release. You want to make sure you go very, very slow, because what happens when we go slow? We have to focus. And what happens when we focus? You do it enough, it becomes it's a cortical thought, meaning it is on the forefront of our brain. The more you do it, the more it becomes a new learned behavior, and it becomes a subcortical memory. So then our bodies hold our themselves more permanently in a neutral position. And then when we tuck and flatten, we're going to do the opposite. So now we're going to engage the back, engage the front, and then lengthen the back. So now we're opening up the back and we're engaging the front. So another thing I want you to imagine is in between your vertebrae where the discs are, we're compressing and releasing. We're massaging those discs back and forth. So if you tend to have bulges and things, this is going to help those bulges gain more space to shift back into the spinal column. So it'll alleviate things like sciatica and herniated disc discomfort and things like that. So you're going to do that a round of each, arch and flatten, about 10 times. Then we're going to go ahead and flip onto our side, and we're going to release our side body, which our side body is what causes a hip to hike. And again, bringing the disc point back up. If you're high on one side, if you're tight on one side, what is your spine doing? It's cramping down on those discs on, let's say, the left side. Let's say my left side's real high. It's squishing down on the vertebrae, which is going to cause the disc matter to have to find somewhere to go, which is going to be the opposite direction. So it's going to bulge out to my right hand side because the left side's so crunched, and it's going to bulge out here, and you're going to get things like bulging disc and herniated disc that cause things like sciatica. So again, we're fixing the problem. So most of the time when people have symptoms, it's a especially with the back, it can be the opposite side that's causing the problem. You're just feeling symptoms on the other side. So now we're going to flip onto the side here. We're going to help alleviate that so we can open up our spine and improve our posture. Once we do all this, our hips and our shoulders are going to become much more limber automatically because now they can really open up and they won't be restricted through the front and the back. So I want you to think about there's a big, huge X from hip to shoulder. We're opening up all those points between the X's. So go ahead and lay on your side, bring your knees towards your chest and your feet forward. And remember, I also have a video, so if you feel like you, on the side curl, so if you need more explanation of this move as well as the arch and flatten, they're separate videos. So you're gonna lay down on your side and pretend like you're seated in a straight back chair so everything's nice and flat. My shoulders right underneath each other. My head is rested on my shoulder. If that's not comfortable, you can do this. You can do this, whatever makes you comfortable. Your knees are going to be at 90 degrees and your feet are going to be below your knees. So I'm really envisioning that I'm seated at one of those fancy dining chairs. So we want to engage the internal and external oblique because when those are overly tight, they shift our hips and they rotate our hips as well. So that if you are high here, you're locking your hip up, and if your internal oblique is tight, you're locking it forward. So then you're going to start walking around like a pirate with a peg leg because your hip won't release and won't allow fluid movement. So let's go ahead and release that in order to engage our external oblique, which is right here. We're going to take our hand over our head, grab our ear, and we're going to lift our upper body. That's going to cause this little accordion effect right here, which is between the hip and the rib cage. And we're going to just let that drop back down. Okay, so to engage the internal oblique, that's to help rotate our pelvis. So we're actually going to lift our upper foot off the bottom foot like this, which is going to rotate our femur head inside the pelvis. And if you put your hands right on the inside of the hip bone, you're going to feel that muscle engage. So if you feel like you may not know if the muscle is doing what it needs to do during these movements, put your hand on that area. That also helps your brain realize what's working and what's not. A lot of people are told that they have weakness in muscles, and really that's not true necessarily. What it is muscles have shut down from habitual contraction or habitually not being used. So what we need to do is we can use our hands for proprioception, which means something for our brains to grab onto, to put it on the muscle. And as you do these kinds of movements, you'll start to notice that that muscle will fire because now your brain has something to focus on. So that's what engages the internal oblique. So the side curl itself is going to be the movement of both, slowly up, and watch. I'm going to make this as simultaneous as possible. My foot is going to touch my other foot, and my head is going to touch my arm at the same time. Why? Because I have to focus. What does focus do? It changes my brain, reconnects my body, reconnects that motor and sensory activity. So now I can talk to my body again where it's been asleep for so long. And you do this about 5 to 10 times, focusing on engaging slowly, slowly releasing. Okay, so you do that about 5 to 10 times. What's really great about this movement is you lay on your back afterwards, and you will notice the side that you just released, the one that was up, is that leg will be longer if you put the heels together. It's really, really awesome. And like I tell my students in my class, you know, you didn't have to go to a chiropractor for that. You didn't have to go to a massage therapist. You did that yourself. And what does that give you? That gives you power over your own body for whenever you're in pain. You know what to do. You know what caused the discomfort. You now know how to get out of it. So you're going to do both sides about 5 to 10 times. And now we're going to go ahead and start to move into some of our shoulder and hip work. So the shoulders and the hips are some of the most complicated joints in the body because of the range of motion. We have so much of it. That's why rotator cuff injuries are so difficult. That's why frozen shoulder is so difficult to work with, because there's so much intricacy, because not only do they go up and down, they go around, which means muscles wrap into each other in the joint. So we need to add some space in our shoulder joints, and we need to massage that area and retrain the shoulder how to let go. Because once we've already done this stuff in the midline, we've already alleviated a lot of the functional stuff that would lock up the shoulder, but now we need to get into the shoulder girdle itself. So you're going to take one arm, you're going to stretch it up, act like you're grabbing a light bulb right here. So I'm pulling my arm up, reaching for that light bulb, putting my hands around that light bulb, and I'm just going to slowly turn it. And when I'm turning it, I'm turning my whole arm, not just this. I'm pretending like my arm's a pole, and I'm rolling the pole in my shoulder. So I'm tractioning and adding space to my shoulder, and then I'm also internally and externally rotating it very slowly. Okay, now what we're going to do is we're going to go across the body and do the same motion. So as you simultaneously turn, you're going to bring your hand over towards the opposite direction. You're going to feel some tugging in the shoulder blade. Again, focus on where you feel discomfort, and that's what you're doing. You're going to engage and release that discomfort as you go. Then you go back to neutral. It's okay if your head turns, but don't cheat. Always reach for that bulb, but don't let yourself do one of these maneuvers where you just your whole body gets compromised. So we're going to go back towards the middle, and then we're going to go towards the same side. So same thing. And you're going to pretend like someone's pulling your arm out as you're rotating it. Now this one's really common to feel numbing, tingling in the arm and hand. The reason for that is because your shoulder girdle is already tight, and as we're doing this, we're contracting the muscles. So temporary discomfort like that is fine. If it's too much, just back off, but that's why it's doing it. The shoulder, that's basically our body saying, yes, you're in the right area, and we need to be careful here, but this is exactly what's causing you numbing and tingling when you're working or when you're sleeping, or you wake up and you have numbing and tingling. It's your body saying, good job, yeah, that's right where I need it. So you're going to do that maybe 5 cycles back and forth. Then you're going to switch and do the same side, back and forth. So we're going to add some space all through here. We're going to traction that out, allow the blood flow to come through the arms, and you'll notice when you bring your arms down, your fingers will tingle. You feel like your hands are warm because there's so many nerve endings in our hands. And the fact that we're focusing on our arms so much, it'll feel like that because you're neurologically more alive, and that causes that tingliness. So you've become more aware of the movement, and now you have more sensation. It's really fascinating. Okay, so we're going to do the same thing with the legs, but first we're going to start with a little tractioning first, or your way to do tractioning. Which tractioning, it just means we're going to pull on something to bring space in between an area. So what we're going to do is I want you to pretend like someone's grabbing your ankle. We'll start with the left, since that one's towards the camera there. And we're going to pretend like someone's pulling it. So we're going to shift. I'm imagining someone's pulling my leg out. And then I'm just going to slowly release. Just do that a couple times. This mimics walking. So when I walk, when I step forward, my leg lengthens. My space here between my side lengthens. And then the other side, my right side, is the side taking the weight of the ground, and which shortens my side. And then go to the opposite direction. And we're just going to mimic that. Someone's grabbing our feet and going back and forth, shifting our hips, and letting it go. You may feel a little bit of discomfort in the back. Again, as you release and move through the movement, just make sure that you keep your intention on that area of discomfort to contract and release. Okay, so once you do that about 10 times, then you're going to pick a leg to start with, and we're going to internally, externally rotate. Okay, first we're going to start with internally rotating the foot. So you're going to pretend, just like we did with the arm, that it's a pole. And we're going to have our leg, I'm going to start with my left leg, and we're going to pretend that, again, someone's slightly tractioning it, but then also internally rotating it, kind of like with the hand. And then slowly ease off. So internally rotate means we're going to roll our leg inward. And then we're going to roll, slowly release. If you notice this is a little difficult, what would cause us trouble or what would prevent us from rolling our leg inward comfortably? It would be tension on the opposite side. So that's going to let you know that you have tension on the outside. And release. Because notice, now I'm going to go the opposite direction. So now I'm going to engage my outer leg and my glute and roll my leg out. See how much more range of motion I can get? That's because these muscles on the outside of the hip and the leg, they're already contracted. They're like, hey, we know how to contract. Come on over here. My inner thigh is not restricted because it's not overly contracted. So it's like, yeah, you go ahead and go over there. No big deal. But if I go on the inside again, my inner thigh hasn't been used as much as it needs to, so it's, quote unquote weak. And then my outside leg is overly tight, so it's restricting. So go internally rotate, bring the leg in about 5 times, then bring the leg out about 5 times, and then relax. And if you have these feet that point out, notice how that foot, once you've done that 5 to 10 times each direction, your foot's going to actually go a little bit more towards the ceiling because now you've evened out the tension on the inside and outside. And then you can do another movement. So you're going to do that on both sides about 5 to 10 times. And then we're going to do another movement where it's the same thing, but we're going to pretend like there's a flashlight at the bottom of our foot. So the flashlight is pointing out. So it's out towards this wall in front of me. And I'm going to slowly start to bring the flashlight towards my inner thigh of the opposite leg as I let my knee fall out. And as I do that, I'm engaging my outside hips so you can see how easy it is for me again because I'm overly tight here. And then slowly, gently follow it back down until that flashlight points back out towards that wall, which would be neutral. Okay, now let's go the opposite direction. Flashlight's going to point outward. So this one's going to be hard, see? So it's going to be flashlight pointed out, knee comes inward, so falls inward. So I am reteaching this to let go and the inner thigh to contract, to pull my leg up. And then slowly, gently do this and same thing. Let it go, back neutral. And then so you do that both sides. We'll do 5 flashlight on the inner thigh, 5 flashlight on the outer side, and then down. So you're going to do that both sides. Then what you can do is do both legs simultaneously so they work independently and at the same time. So it's going to be bringing both legs out like a frog, both legs in and neutral. Both legs knock-kneed, both legs neutral. You'll do that about 5 times. You can see how moving the hip joints in and out and back and forth and one leg at a time, both legs at a time is really waking up the hip muscles, not only waking them up, but simultaneously rebalancing them and releasing the tension that's in them. So you're going to do that last move about 5 times. Then we're going to lay on the ground, and then we're going to do something to finish out this series called the washcloth. So you're going to bend both knees. Knees and feet are together like this. You're going to bring your arm out like a T. And I want you to go ahead and turn one palm down and Again, arms a pull, so one arm down, that shoulder's going to want to roll up, and then the palm up, the shoulder's going to want to roll back. So face the palm up with your head, so your nose is going to face the palm up, and then we're simultaneously going to switch directions of the palms and the shoulders while we follow the hand that's turning up. So you're just going to do that. So as we're doing this, this is called the washcloth. We're pretending like there's a washcloth in between our shoulder blades and we're wringing it. Which what happens when we wring something, it lengthens and it opens. And then there's also, because we're turning our head with it as well, there's a washcloth in between our shoulder blades and our neck. So we're also gaining neck range of motion. Okay, then we're going to pause. So our head's going to be facing the hand palm up still. The other one's palm down. And the nose hates the knees. So let's just let the knees drop away from the nose. Now we're going to add that movement into it too. So now we're adding a washcloth movement through the spine and elongating the spine. So this one move is helping traction our shoulders, regain range of motion in our shoulders and our neck by lengthening them, and lengthening the spine and releasing the hips. So if you only have one move to do daily, this is the one to do. So again, be as simultaneous as possible, because that's going to retrain our brain to focus and make new memory, muscle memory. So you do this one as much as you like, as make yourself comfortable. You know, this one should be a really easy, flowing movement. All of these movements are not meant to be painful. If you feel pain, you use it as a stopping point and knowledge. So if I feel discomfort when I'm rolling my arm in and I go, ooh, ow, I'm not going to keep going. I'm going to go, ooh, ow, I'm not going to go that far next time. And I'm going to go, ooh, ow, it hurts here. And as I release that movement, I'm going to focus on really releasing that area. And then next time when I contract that area, I'm going to go, okay, I'm going to really focus on that area that just hurt. And I'm going to contract it and I'm going to release it. So think of it as retraining and not stretching. So once you're done with your practice here, you can lay down, do another body scan, kind of see where your body now is placed throughout the floor, and you should feel much more tingliness, aliveness, blood flow increase, because you've increased that sensory motor system response in your brain and you've become more aware of it. So I would try and do these movements at least 3 times a week when you're really getting into gaining more range of motion, or if your shoulders and your hips hurt on a regular basis. Now, one of the best things about this type of therapy and movement is that because we're so focused and because it's a reprogramming your brain and changing your muscle memory, it's like riding a bike. So you're going to do a bunch of it at the beginning. You know, be persistent and patient. But the good thing is you're going to get out of pain. And then let's say 3 months pass and you go, ooh, my shoulder starts to hurt again. You're going to do this 1 time, 2 times, and you're going to get out of pain, because your brain is going to know, oh, we've been here. It's like riding a bike. Oh, I know, I remember what it's like to feel this. I remember what it's like to let go. So you guys just try this out 3 times a week if you can. Be patient. Learn how to talk to your body again, and I'm telling you, it can be life-changing. So if you guys have any questions, please comment below. Thank you for joining me for this video. And if you want to reach out to me personally, you can always email me at jen@fusionwbrecovery.com, or give me a call at 817-442-9424.